First, I am going to start off the video by doing intramuscular injection. I would compare the physician orders with the MAR, and then I'm going to identify the patient, perform hand hygiene, and put on some clean gloves. After that, I would do a focus assessment. Then I would compare the medication to the margin and check for the expiration date. Now I'm going to clean the top of the vial. Now I'm going to aspirate the volume of air equivalent to the dose of the medication and inject it into the vial. Now I'm going to withdraw the medication. Trying to maintain the sterility of the medication and making sure there's no air bubbles. Now I'm going to withdraw the medication out of the needle, and then I will safely cap it and appropriately change needles. And then I would label the syringe if withdrawn outside of patient's room. After labeling the syringe, I would go into the patient's room and perform a third check. Then I would explain the procedure to the patient, identify sites, clean the site with alcohol swab using circular motion. Then, using the Z technique, I would insert the needle into the patient's skin at 9 degrees. Aspirate, slowly administer the medication, 1 milliliter over 10 seconds. After that, I would leave the needle in the patient's skin for 10 seconds. Next, I would withdraw the needle. Do not cap, gently apply an alcohol pad to the site. Then I would safely dispose the needle into a biohazard bin. Then I would remove the gloves, perform hand hygiene, and document. Now I am going to perform mixing and administration of insulin. First, I would compare the physician orders with the MAR, and then I would identify the patient, perform hand hygiene, put on clean gloves, and then I would perform a focus assessment such as CBG level, signs and symptoms of hyperglycemia or hypoglycemia. Then I would compare the medication with the MAR and check for expiration date. Next, I would clean the top for both the vials. Now, I am going to aspirate the volume of air equivalent to the first dose of the first medication, which is NPH. And then I would inject it into the first medication, making sure it doesn't touch the solution. I would withdraw the needle, and then I would aspirate the volume of air equivalent to the dose of the second medication, which is regular, and then I would inject the air into the vial. Then I would withdraw the medication. Now I am going to withdraw the needle and insert it back into the NPH and withdraw the dose of a medication. And then I would withdraw the needle, safely cap it, then I would label the syringe and verify it with the second nurse. After verifying with the second nurse, now I am going to go into the patient's room, and then I would perform a third check. Then I would explain the procedure to the patient. I would clean the site, and then I would pinch the area. If you can pinch 1 inch, you would insert the needle at 45 degrees. But if you can pinch 2 inches, you can insert the needle at 90 degrees. And now I would inject the needle into the patient's skin, slowly administer the medication, and then I would withdraw the needle. Do not cap. Gently apply an alcohol pad to the site and safely dispose the needle in the biohazard bin. Then I will remove the gloves, perform hand hygiene, and document.